There's an indented area here, right? So the long part you feel is L4, and the round one is L5. So the L5 is next to the L4, and oh, there's quite a bit of muscle tension. So if I press like this, which side goes in more right now? The left side goes in more, indicating a PL, but upon lifting it, I notice something else. This side doesn't come up as much. It's a PLI, right? If I lift it, this one stays, this one moves. So it's a PLI. So you should perform the mammillary process adjustment from this side. You understand? To perform the adjustment properly, you must first fully grasp this concept. Now let's discuss the patient setup procedure. Please lie on this side facing me. Come forward a little right there. And you do it like this. This is actually when it's a transverse process or an MP adjustment. For an MP adjustment, rotation is needed, so it's best if the bottom hip isn't visible. Thus, the hip bone underneath, if it's tucked in and out of view, allows for a greater joint lock with just a slight pressure, right? Then just comfortably extend this arm out to the side. Just relax this. A significant amount of rotation is required for a proper adjustment. And also, you need to lift it past 90 degrees like this. That's how it locks. Here at the L5 lumbar, if you place the contact point on the SP and move it up and down in a superior-inferior direction, you should feel a lot of movement here. The problem is, if I'm setting up a patient for an adjustment maneuver and the setup loosens, then the joint lock will completely disengage when I try to rotate them for the actual adjustment. So once you've set this, you have to maintain it. Then, if you draw a straight line from the iliac crest, the L4 vertebra is above it. You can see the L4 spinous process, right? The SP. So you're going to toggle from the opposite side and rotate it this way. Then lift and press all the way through at the end. You can't be tense. So, my elbow needs to drop quite a bit after making contact, like so. Does that hurt? It's okay? Yes. I can't be too forceful since he has a disc condition. So that's a transverse process adjustment. SP adjustment is quite the opposite. For the other side, come forward. So for an SP adjustment, since it's a PLS, meaning posterior, left and superior, I'll rotate the patient in the opposite direction. There's no need to dramatically twist their lower back. And you need to rotate the patient quite a bit. Before, for the MP, I worked from above, but for the SP, I need to hook directly like this, and if the bottom hip bone is hidden, I'll slip. So it's better to turn the patient a bit like this. Turn them, lift high, and push straight through from here like this. Since he mentioned having had a procedure, I'll demonstrate the maneuver specifically for his disc condition. For disc treatment, okay, interlace your fingers. You can interlace them. You can interlace your fingers or simply hold onto my arm, like so. For a complete adjustment, you would grasp it in this exact manner. Now let's consider if it's a PPL or even a PLI. Regardless of whether it's an S, if the spinous process rotated the other way, I make my contact here and rotate him, right? Right? But not for disc patients. Rotate them here. You must hold them like this. Hold them like this. And with this leg, you have to lift it up high. See how he rotates again like this. If rotated this way, even a disc patient can be adjusted boldly. It feels good, right? You have to do it this way. I couldn't just roll and push the way I did before with a disc patient. That's why I didn't push. This is a comprehensive adjustment, utilizing the elbow adjustment technique. Please go ahead and sit up for me. Just one more. PR, right? PRI, right? Let's try lying on this side once more. Now, if this person, for instance, has pain on the right side, the type of adjustment you perform to specifically alleviate that pain is to firmly hold the sacrum in this manner. Hold it like this. And as you lift this leg, you open it up a lot, just like this. You can't simply rotate it. It's the same for facet syndrome or a patient with a disc condition. You hold them like this and give a little opening thrust instead of rotating.